Hello, my name is Vaskin Dilsizian. I'm here at the CardioSource Video Network. Joining me today is Dr. Daniel Berman from Cedars-Sinai Medical Center and Dr. Robert Bono from Northwestern Memorial Hospital. They're both well-recognized, preeminent leaders in the field of nuclear cardiology. Dr. Berman, you have an intriguing paper that will be appearing soon in JACC Imaging, where you present clinical data for the first time in a novel high-speed SPECT imaging where you look at myocardial perfusion. Could you tell us something about the camera? How does it differ from the conventional camera, and also some of your results?
Thank you, Vaskin. It's very exciting. This is the first development that's truly significant in regular gamma cameras or in single photon gamma cameras in 50 years. The design of this camera has solid-state detectors in an array that lies behind tungsten collimators set up very differently from the standard camera. A bank of multiple detectors rotates back and forth such that a camera is able to obtain approximately 8 times the count rate that we can get with a conventional dual detector camera, and at the same time have higher resolution.
That's great. Dr. Bono, as you know, this is an exciting times of all kinds of advances in technology, including hybrid SPECT CT, PET CT. Could you tell us where you would place this advancement in SPECT technology given the changes that are occurring with other technologies?
Well, it is an exciting time, and we have lots of opportunities to investigate new imaging modalities. Dr. Berman's group has for years given us new forward-thinking ways of imaging more efficiently, new imaging protocols, the way of doing tracers, dual isotope. It really has changed the way we practice nuclear cardiology, and this could be another one of those advances that we get from Dan's group. But it's new. It may improve throughput because we can image our patients faster, so a large laboratory like Dan's might be a place where this would work well. It may not work as well in a less busy laboratory, although you could reduce expense with higher throughput. The equipment itself might be more expensive. We don't know. We'll have to see how that shakes out. Many cardiologists are pretty set doing SPECT, and now they're also grappling with these other things, SPECT, CT, PET CT. Where would this newer high resolution, high sensitivity, high count rate detector fit in? It is very exciting. It's also a relatively small study thus far. It would be good to replicate this in larger patient populations. It looks like the accuracy is as good as the standard SPECT camera. It does not appear to be better.
Dr. Berman, now that we've learned about the technical advancements, perhaps you can tell us more about the clinical findings and the results, how this compares to the clinical studies we currently perform with conventional SPECT imaging.
In this first clinical trial, what's been shown is the accuracy appears to be the same as we have with a standard camera, but with images that we're able to obtain with the patient sitting in a comfortable position and being imaged for only a 2-minute period of time. The other significant finding was that the image quality was uniformly superior with the new camera as judged by the interpreter compared to the standard camera approach.
That's great. Dr. Bono, given the environment of decreased reimbursements for cardiac imaging and a lot of cost cutting in major hospitals as well as large cardiology practices, undoubtedly this technique will have a higher price tag than the current SPECT cameras. How do you foresee in the future with this technology and other technologies kind of being introduced to the market where it will have certainly an advantage of detecting disease or improving prognosis, but yet the reimbursement isn't there?
Well, it's a uncharted playing field right now, and I think the new technology we're addressing here has the potential, because of its higher throughput, maybe greater accuracy, better image quality, to make a more accurate diagnosis in a more rapid time frame. So
That's
again,
great.
for throughput issues, that may offset whatever the expense of the camera itself may be. It may not be any more expensive than a SPECT camera. We don't know that yet, but obviously we have SPECT cameras in place already. So we may be talking about when equipment needs to be exchanged or replaced. But clearly, we need to get more data. It's very,
Yes.
very exciting. Maybe also we're talking about new agents or new ways of using standard agents, teperoxine, for example, where we can get really rapid image acquisition. Might be an agent that comes back into clinical practicality.
That's great. I've truly enjoyed talking to both of you. I appreciate your insightful comments and your continued contribution to the scientific field of nuclear cardiology. Thank you very much.
Thank you for asking.